Hello guys, thanks for liking my videos and subscribing me. Also do me a favor to share the videos and study hard. So in this video I am giving you an insight for the Neet PG as it is very near. So they in this year in Neet PG, as it will be a one-day session, there is a very much probability that they will be asking a very large number of picture based MCQs. So this video will give you insight of the important topics from which MCQ can be asked, and also in what form they can ask the MCQs. So stay focused, and starting with question number 1. Here there is a photograph of a child. This type of skin lesion is seen particularly in which condition? So you can see the characteristic lesion, and while reading the options you will come to know that the answer here is tuberous sclerosis. Now this tuberous sclerosis topic is very important for your exam, and you must know every point from this topic. So try to read tuberous sclerosis from your notes or from any standard books like Harrison from the newest edition. So some points which have not been asked till now but are very much probability that it can be asked in future is that the tuberous sclerosis gene TSC1 and TSC2. TSC1 is a 130 kilodalton gene encoding for the hamartin protein, and TSC2 is coding for tuberin. So you must remember that TSC2 code for tuberin and TSC1 codes for hamartin. And you must know every point about tuberous sclerosis. Adenoma sebaceum you can see in this picture, and it is an autosomal dominant trait. Moving to question number 2. So you came to know one important topic, tuberous sclerosis, and I think you already know this, that it is a very important topic. Now seeing this diagram of the fundus, you can see means rule out the options what it can be. Here the fundus is showing you a picture of proliferations of the blood vessel, means neurovascularization at disc. So it is commonly seen in diabetic retinopathy. So here the answer is diabetic retinopathy. So from the eye, the diabetic retinopathy is an important topic from which they can give you a picture of fundus and ask you some questions. So you must revise the diabetic retinopathy topic, and all the characteristic fundus signs you see, you just google it and that will fit into your mind, so that you cannot make these mistake in your exams. Now the third part, which is now being very frequently asked, is the audiometry. Means you need to study the basic audiometry, and by only knowing the basic audiometry you can answer most of the questions from the audiometry, like what signs are for which ear. Means this circle sign is for air and the bone sign is for what, means different signs of the audiometry, pure tone audiometry, and how to interpret it. What is mild, moderate and severe hearing losses, and how will you characterize, means it is a conductive type of hearing loss or it is a sensory type of hearing loss, whether bilateral or unilateral. So in this pure tone audiometry, you see there is a wide airborne gap of around 50 decibel. Okay, so there is a wide airborne gap of around 50 decibel. So it is a moderate type of conductive hearing loss and bilateral. So here the answer will be bilateral conductive hearing loss. So moving to another question. So revise the pure tone audiometry from your E.N.T notes or book. So what is your diagnosis of this child having widespread skin lesions? From dermatology also, dermatology is very prone to ask the picture based questions. So see scabies does not show this much widespread skin lesions. Psoriasis rarely possible or maybe possible. Lichen planus is not. Seborrheic dermatitis very much possible. In this age group, that is infantile, there is there is means prone they are prone to have seborrheic dermatitis, and it is an important topic for your picture based diagram from the E.N.T. So you must know about seborrheic dermatitis. And one thing also you must know that the seborrheic dermatitis is a common cutaneous manifestation in AIDS patients, in young AIDS patients, and characterized by thick greasy scales on the scalp and large hyperkeratotic erythematous plaque on the face, chest, and genitals. Now, question number 5: a patient is presented with enlarged great toe as shown in the photograph. So, this is seen in which condition? This is somewhat a rare type of question, and very few people will do it. Or actually, in all the four syndromes, it is seen in tuberous sclerosis, Proteus syndrome, neurofibromatosis. So, here the answer will be all of the above. So, macrodactyly is seen in all of the above, namely Proteus syndrome, neurofibromatosis, tuberous sclerosis, Kippel Trenau syndrome. So just know these some little points about this syndrome, and you will be able to answer the questions from this syndrome. Now this photograph shows which type of test. Now in orthopedics there are many tests, so you must know how to do different tests, and they may ask you by giving a picture. Like in last year AIMS exams, they have given one clinical picture and was asked which type of test the doctor is doing. So here the doctor is doing anterior drawer test, and it is basically done for the ACL injury and is performed when the patient is supine. See, the patient here is supine and knee is at 90-degree flexion. Another test which you must know is McMurray test, mainly done to assess the meniscal integrity, and is also performed when the patient is supine. But here the examiner will be standing on the side of affected knee, while here if you observe, the examiner is sitting and the knee is at 90-degree flexion. Another test, lateral pivot shift test, you can read from your ortho notes. I am not giving time over here. Now question number 7: following organism can cause disease mimicking like which of the following? So from here you came to know that from microbiology also they can ask picture based diagrams basically of fungus. Means the fungus topic from your microbiology is very important, so do revise the topic fungus mycology from your microbiology notes. So here the organism is Histoplasma capsulatum, as this is a spiked spherical conidia shown in the diagram, and it causes miliary TB like disease. And the extra point here is that coccidiomycosis causes desert rheumatism. So it can be asked as a single separate MCQ in your exam, that desert rheumatism is caused by. So it is caused, the causative organism is coccidiomycosis. So do revise mycology from your microbiology notes. Which type of sensory receptor is labeled as X? So see, another thing which people can ask is from your physiology, means the different reflex. What type of reflex is shown here? Monosynaptic, bisynaptic, and all. And here it is the Golgi tendon organ which is being shown here in a series of muscle fibers. So you must have basic concept about this Golgi tendon organ, nuclear chain, nuclear back fibers. Revise it from your physiology notes. So another thing from anatomy, a lot of question can be asked from anatomy, and the first thing which you study after getting your MBBS in first year is the brachial plexus. So this question is from the brachial plexus, and I believe that you will be able to mark it correct. So it is asking what is X. So X here is median nerve, formed by the joining of lateral and the medial cord, and the brachial plexus root is C5, C6, C7, C8, T1. So do revise your brachial plexus section and all the other anatomy important sections, as it is very important subject for your NEET PG. Means many people do wrong in anatomy, but it is a very scoring subject. So do revise, it's very small, and try to think that everything can be done. Means do not take, means fight your fears. Take the subjects which you feel are difficult on your first go. Means give them preference over the easy subjects. Means what you feel tough. Means for somebody dermatology might be tough, for somebody medicine might be tough. So what you need to focus in this last 10 to 20 days is that you need to revise everything, but give more time over the difficult subjects. What you feel is difficult for you, means you have fear over that subject. By overcoming the fear, you will get those questions from that subject right during the exam. You only need to remove fear in this 10 to 15 days. Means before attempting your NEET PG exams, you must be 100% confident in each of the every subject that you have given you 100%, and you cannot attempt the exam with a doubt in a single subject, because that doubt will make you, means can make you attempt the question in a wrong way even if you know the answer. So just believe in yourself and have 100% confidence that whatever time you have got, you have utilized it wisely, and no one other can perform better than you. So you are going to rock the exam basically. So question number 10, what is your diagnosis for the following examination of fundus? Here you can see the size of the optic disc is enlarged. So basically it is a the diagram of papilledema. It is showing papilledema. It's a very peculiar, very peculiar. You can see this enlarged ratio. Now what is the diagnosis for this baby? You can see there is a means a semi-lunar fold of skin for this baby on the both side. So it is epicanthal fold, and it is normal in Mongolian races, and it can be means it can be corrected by plastic surgery, and usually with development of nose the deformity gets corrected, means the epicanthal fold disappears. Moving to question number 12, the infant in the following picture A and B presented with hepatosplenomegaly, anemia, persistent rhinitis, and a maculopapular rash. What what is the likely diagnosis for the child? So see, there are multiple involvements: hepatosplenomegaly, anemia, persistent rhinitis, maculopapular rash. Characteristically, if you see the option, the all the symptoms belong to congenital syphilis, means you can relate with congenital syphilis but none of the other diseases. So you must know syphilis, leprosy, tuberculosis. These topics you must know from everywhere. These are the means hit topics, and you cannot afford to make them wrong in your exam. So moving to question number 13, a 3-year-old girl is admitted with X-ray. The child lives with her parents and 6-week-old brother. Her grandfather stayed with family for 2 months. The grandfather had a 3-month history of weight loss, fever, hemoptysis. See, all the means characteristic features of tuberculosis you are finding here: weight loss, fever, hemoptysis. Means the child was exposed to, means there was a history of exposure to a tuberculosis patient, and on X-ray you can see characteristic lesions, means scotch spots on the X-ray. So basically you need to treat that baby for the ATD regimen with the treating the 3-year-old patient with the isoniazid and the rifampicin. Also you should know the prophylaxis for the exposure, that means the dose of the isoniazid for the babies who are exposed to tuberculosis patients. Now question number 14, means you must know every point about RNTCP, the new RNTCP guidelines. True statement about this structure shown below is: unicellular grown form of fungi, no; thread-like cylindrical tubes, no; clumps of intermingled branching hyphae, yes. So these are basically clumps of intermingled hyphae. So you must know different types of fungi, aspergillus, how it looks, what angle it makes, so that you can identify it easily and should not waste your time in this type of questions. So do revise mycology section from the microbiology. I am repeating this. The picture shown feet of the patient. What is the most likely diagnosis? Here the picture showing mycetoma basically is caused by fungi, but it is also caused by bacteria also, and in this case staph aureus is the most appropriate answer. You can read about the mycetomas from microbiology. Moving to question number 16, a 25-year-old woman noticed increased number of white spots on her scalp hairs 2 weeks earlier. Examination of hair shaft shows multiple white nodules completely encircling the hair shaft. The culture grew yellowish to creamy fluffy colonies. This is characteristic of. So mainly in this question it is describing Trichosporum bigeli, that is white pedra, because here the balls are the white, means the nodule is white. If in question if it is mentioned that the nodule is dark, then it would be pedria horti, but if it is given white as in this question, it will be Trichosporum bigeli. So it's also important section from the dermatology, and acne is also important from the dermatology point of view. So here the answer will be white pedra, that is Trichosporum bigeli. Characteristic features. Question number 17. An aerobic oxidase positive organism is isolated from the sputum of the 12-year-old cystic fibrosis. See, you need to point out characteristic points from the question for you to uh, make the answer right. Cystic fibrosis patient having pneumonia. So you must know what organism can cause pneumonia in a cystic fibrosis patient. On agar culture, the organism have a fruity odor and a greenish colony. Another thing, greenish colony, fruity odor, all the things pointing towards the Pseudomonas. So answer is Pseudomonas aeruginosa. Another thing, a pap smear of 30-year-old demonstrate the following pathogen or organism are likely. So here this section from the gynecology is also important, bacterial vaginosis and all. So you must know how the organism looks like. Just Google it and you will not make it wrong in your exam. So here in this question basically the diagram is of Trichomonas vaginalis. You can see the undulating membrane, the flagella and all. So it's a very important question, and the means very high probability that this topic will be asked in your NEET PG. Means make sure 1 to 2 questions are there in your NEET PG from this topic with bacterial vaginosis and all. So do remember how to differentiate and all, means from the fungal candida and Trichomonas vaginalis and all. Do remember to revise this. Question number 19 and then question number 20. I am means making it fast so that you need not to waste, means spend much time over this, and just get an idea, and maybe 4 to 5 question, or some if some question means come make to happen in your exam, then you will be getting an extra benefit. An obese 32-year-old diabetic woman presented with complaint of red painful skin in her abdominal skin fold. Examination reveals a creamy white material at the base of the fold. Microscopic examination of the exudate reveals oval budding structure. The most likely causative agent is, see, the points you need to point out here is the patient is diabetic woman. Okay, then the lesions are painful. Another thing is creamy white, creamy, so all pointing towards the candida. Where is candida? See here, candida albicans. So answer here will be candida albicans. H and E, stain of biopsy specimen from AIDS patient shows spherules with endospores. Lactophenol aniline blue preparation is shown below. The most likely organism is a somewhat of rare type of question, but just remember, if it came, we will make it right. This is character tissue appearance of C. mitis, which is a dimorphic fungi. So it is a candida mitis. This fungus causes desert rheumatism. Oh, it is the coccidioidomycosis mitis. You just means make it confirm what is C. mitis. So the answer here will means actually C. immitis is Coccidioidoides immitis, not Candida. So in AIDS patient, it basically happens in AIDS immunosuppressed patients, and it causes desert rheumatism. So it is a quite new question that desert rheumatism is caused by, and here they have asked by giving the picture also, caused by C. immitis. Coccidioidomycosis immitis. So thank you guys. Do share and study hard. and all the best. You will get your desired PG seats. Thank you.